So the state of Missouri is actually, if you look at all 50 states plus DC, the lowest funded public health state from general revenue when you look at per capita public health spending. So the terminology I've used is that Missouri underinvests, has a historic disinvestment in public health, and that especially affects the local level, where it's really those local-based services, those local community services that are face-to-face community services with people that make a difference. The project that I lead using PHIG funding is the Foundational Public Health Services Cost Gap Analysis, which is a project where we have a contractor who is collecting information from all 115 local public health agencies in Missouri. It's quite a few, and they are taking information about what their current funding looks like, their current staffing, and comparing that to where we believe we need to be to effectively deliver services to all Missourians where they live in their communities. And they're taking that information, that data, synthesizing that, analyzing that, so that we'll have a report that indicates what that implementation gap is to truly deliver effective public health services to people where they live. The hope will be, from a statewide perspective, we can make system-level changes that will then improve services at the local level. But even in the meantime, we can see that local agencies are able to improve their functions and improve their resource use to better serve their citizens in the meantime. The reason why PHIG is so essential is because for the history of public health in the United States, it's often gone from diagnosis to diagnosis, disease to disease, and it's focused on just what happens in the moment. And what has really been realized with public health infrastructure efforts is that we have to build up a better public health system to address these conditions. It's having a public health system that can serve everyone the way it needs to and be ready for those events, so it has the capacity to respond and to provide better services. PHIG funding is absolutely going to allow us to save lives because public health is unique in that it affects every human from conception until death. It's the entire lifespan. If we're able to improve quality of life and health at the beginning, we're able to then do that through the entire lifespan, and we ultimately end up with healthier individuals that live longer lives. And that's what we're trying to do in public health, is just help every person have the best optimal health that they can have.